Love Bay family, and welcome back to the Mental Health Hour on Love Bay Afrobeat Music and Talk Radio. I'm your host, Felicia Fishoff, registered psychotherapist and founder of Rooted in Resilience Psychotherapy and Wellness. And tonight, we're stepping into another powerful She Speaks conversation. Tonight's episode is titled, Does Representation in Therapy Really Matter? Let's talk about it. When we talk about finding the right therapist, we often hear about credentials, experience, training, therapeutic approaches, and all of those things matter, no doubt. But what about representation? What about culture, identity, lived experience, and the ability to walk into a therapeutic space and feel that you do not have to explain, minimize, translate, or leave important parts of yourself at the door in order to be understood? For many people, therapy is one of the most vulnerable spaces they will ever enter. We are asking people to share their stories, their fears, their relationships, their families, their trauma, the parts of themselves they may have spent years trying to hide, protect, or make sense of. And that raises an important question. Does representation in therapy really matter? And if it does, what does meaningful representation actually look like? Because representation is more than simply seeing someone who looks like you. It can also be about trust, safety, understanding, access, belonging, and whether the person sitting across from you has the willingness and capacity to understand the cultural, social, and lived experiences they have helped that have helped shape who you are. Tonight, we're going beyond surface level conversations about diversity to explore how identity, culture, and lived experience can shape the therapeutic relationship, and why feeling seen, heard, and understood can have such a powerful impact on healing. I'm joined tonight by Fiona Andrews, a registered school and clinical psychologist and the clinical director of Embrace Well Psychological Services in Ontario. With over 15 years of experience in educational settings, along with additional experience in private practice, Fiona specializes in comprehensive psychoeducational and psychological assessments for children, adolescents, and adults. She is passionate about increasing access to culturally responsive mental health services and advancing representation within the field of psychology. In addition to her clinical work, Fiona provides supervision, develops educational workshops, and creates content that bridges research, real life, and community conversations about mental health. Together, we'll be unpacking the role representation plays in therapy, the gaps that still exist within mental health care, what culturally responsive support actually looks like, and why trust, safety, identity, and belonging matter in the therapeutic relationship. Whether you are seeking therapy, providing therapy, or simply interested in understanding how culture and identity shape our experiences of mental health care, tonight's conversation is for you. But before we begin, just a gentle reminder that while we discuss mental health, identity, culture, and the therapeutic experience, this show is for educational and community support purposes and is not a substitute for therapy, psychological or medical advice, diagnosis, or crisis support. If something resonates with you tonight, we invite you to share this conversation with someone who may need to hear it. And as always, the chat is open. Drop your thoughts, reflections, and questions throughout the show. We'd love to hear from you. Fiona, welcome to the Mental Health Hour. Hey girl, how you doing?
Good. Thank you for having me.
Oh girl, it is a pleasure. I'm telling you, Love Bay family. Fiona is honestly such a gem. I don't know. I was stalking her page for a little bit, and I'm telling you, she had an amazing event recently that really brought together the psychologist community. And love it, you know I have no shame, right? So I'm there typing up in the chat as in the email, Fiona, I know I'm not a psychologist, but can I come true? And she graciously opened the door to have this crazy therapist join her. And it was such a beautiful event. Just having different Black psychologists that were present, that shared in such a beautiful, authentic, and vulnerable way. And the food, boy, love it, I love my food, and the food was good. I was there for more than the food though, Fiona. I'm just saying that the food was an extra bonus and an extra plus. But it was, yeah, I left there feeling empowered. I left there feeling connected. And so she is doing amazing work. So welcome, 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 welcome.
You so much.
You're so very welcome. So, Fiona, I usually love to start off our episodes by asking, why does the Love Bay family need to be talking about tonight's topic? Does representation in therapy really matter?
This topic's important. Just mainly because, especially growing up in cities that
Yeah.
where the majority, you're not the majority, you're the minority.
Mm,
So the people around you you're seeing in professional capacities are not necessarily people who look like you. As a child, you're growing up with like white teachers mostly. For myself personally, I never had a Black teacher until I was in my master's level of school.
mm, mm-hmm.
And other people of color, I've had one or two like Asians, one or two South Asians, but the majority of my teachers were white. So when it comes to having representation, having someone that looks like you makes you feel like you're not alone, makes you feel like,
Mm,
okay, people in professional settings, there's a place for us there too. And you're, it's just, you're able to just be yourself.
yes, yes, absolutely. And I think that yes, it is so important, right? And there's obviously different layers as to why this is important, but you're right. Like growing up, we didn't always see people who look like us. And, like I was mentioning in the intro, right? Like therapy is one of the most vulnerable spaces where people are sharing parts of themselves, their history, their experiences, their lived experience. And, especially throughout various places in society, right? Um, we feel like we have to mask up a lot, right?
Yeah,
Hmm.
for sure.
Absolutely. So, why do you think, one, that people are hesitant to see therapists that may be outside of their culture? And what benefits have you seen for having, maybe other clients that, when it comes to like your culture, you're able to share those things with them?
Well, first off, mental health is still a stigma among people of color. And for
Hmm.
talking about Black people, it's still a stigma like, amongst our community too. So that's the first barrier to get
Yes.
over. Once they're comfortable in seeking the help, now they're looking for somebody that would understand them. And
Hmm.
especially when you are, a lot of the mental health issues that you may be having is because of systemic racism. You might not be comfortable talking about those experiences with somebody who looks like the person who's oppressing.
Hmm.
And it's not that you may not necessarily find people who are of other cultures not able to work with people who are Black. But just having that opportunity to not have to necessarily explain that piece, and the person already understands and knows,
Mm-hmm.
can make a big difference. So having that um, trust to be able to trust that the person believes what you're saying about the racial discrimination experiences that you may be having. Because if that person who you're speaking to thinks that, oh, you're just having, that's just a negative thought, you could, let's learn how to challenge that thought, when in reality what they're experiencing is not a thought, it's like actuality. This is what is actually happening to me. And even if I change my, or try to change my thought, it's not helping, because the situation is still the same, that racial discrimination that that person might be experiencing. So someone who understands and is able to navigate that conversation helps.
Mhm. Absolutely, absolutely. And you're right, context is super important, right? I remember there was a time that one of my clients came and she said, Alicia, I brought my rag today. I said, oh boy, you brought your rag. Okay. It's going to be that session. And we could laugh about it. But I knew that this was a session that I had to really just hold space, because there was something that would come that they would need to release. Right. And she did use that rag. Right. And similar to myself, right? Big up to my own therapist. I saw my own therapist today. I said, I always talk about you, you know. She's like, you are too much. I said, I know I'm too much in the best of ways. But yeah, I come with my nice big bowl of oxtail, and she knows when I'm bringing a big bowl of food that I am about to drop something that I need to really process and talk about. And there's something about that comfortability that we need. And I think that I find that especially um, with within Western culture, especially like the models that we use weren't necessarily built with us in mind, and it can come off as cold clinical sometimes. That can create a dissonance and a disconnect.
Yeah.
Right?
Yeah. A lot of the research that's been done
Mhm.
has been the white males, and doesn't necessarily consider other races. So when we're using those frameworks, it might not necessarily fit in with the different cultures that you might be working with, and even genders too.
Like, what have you noticed with regards to what that even looks like in a practical way?
Well, now that we're, when it comes to, like, for example, like diagnosing certain disorders like ADHD, for example,
Mm-hmm.
um, there was a lot of like underdiagnosing of girls, and overdiagnosing of like boys and Black boys. Um, but now that we're getting more familiar of like what it looks like for different cultures, now we can understand, and different genders, now we could
Mm-hmm.
understand what to look for when we're working with a Black girl, for example. It might look different for a Black girl versus another race and another gender. Same thing with depression. Um, we look at sadness as like one of the main symptoms for the diagnosis, or
Mm-hmm.
low mood. But when it comes to the Black community, we learn to like suppress the sadness, and
Yep.
sometimes it looks like irritability instead. So
Mm.
knowing that is like a possibility of like depression, the person who's very irritable, knowing that usually in Black communities that is how it presents, then you start looking down further that avenue versus looking elsewhere to explain the irritability.
100%. Absolutely. Because I think, again, that speaks to that that lived context, right? So having that deeper understanding that for a lot of us, we don't have necessarily that luxury to stay in bed. And it's not no knocks to if that's how you experience depression, because there's so many different representations of it. But many of us are high functioning. So even though we feel the sadness deeply, we still get up because, again, there's those systemic barriers that we face that we can't afford our livelihood. So we have to get up and keep going despite how we feel and
Mm.
despite what we're experiencing.
Yep.
Mhm. Good. I know that you do psychoeducational assessments as well, right? So
Yeah.
having a culturally attuned lens, to your work, how do you think that that plays into even your own work as you are doing these psychoeducational assessments? And for those who don't know what a psychoeducational assessment is, maybe you can explain that as well.
Okay. So a psychoeducational assessment mainly is looking at your learning profile. So what's
Hmm.
included in the assessment is your cognitive functioning assessments, academic functioning assessments, and we also include behavior and emotional functioning assessments as well. And possible outcomes from doing these assessments might be like a learning disability, where you have the ability, but then there is a discrepancy between your ability and your academics. Your academics are much lower than what we would expect. And then another outcome might be maybe ADHD, attention deficit hyperactivity disorder, to explain why somebody has having difficulty like sitting still or having focusing, paying attention and focus. So when it comes to the culture aspect or being culturally responsive, not just looking at the scores is very important when
Mm,
these assessments, because sometimes we might have an assessment. One of the, actually, if I give an example, some of the rating forms, it, when you fill them out, it
yeah.
gives us like ranges for different possibilities of disorders. So it might
Hmm.
show that this person has significant concerns in anxiety, and significant concerns with symptoms of autism, significant concerns with symptoms of ADHD. And sometimes when we get back those forms, everything's elevated.
Mm.
So in my mind, how can somebody have all of these diagnoses? So if we
Yes.
rely on just the questionnaire itself,
Mm.
consider like context and consider the culture and consider um like a whole other slew of things to explain why this person responded the way that they did, um,
Mhm.
that helps with the assessment process and helps to narrow down what exactly is, or what disorder or diagnosis would best explain their experience and what they're going through and the symptoms that they're endorsing.
That's amazing. So when you see these elevated scores, and you said, "But wait, how come everything is elevated?" How do you begin to take that context into consideration?
Sometimes when you see things like that, it's almost like a cry for help. They're
Yeah.
showing you that, okay, I'm struggling here. Please see that I'm struggling. So everything is very much true, very much true, very much true, or always and happening all the time. Because they
Yeah.
want to let you know that I'm struggling here. Can you make sure that you give me some kind of diagnosis to help me get the right treatment?
Yes. But that comes from somewhere because we know. I mean, again, I am not a Dr. Peoples, okay? So that's my disclaimer. But we see this in, health systems all the time where we're overlooked, our symptoms are overlooked. And we feel like if we don't, if we're not on the brink of death, we're not going to get the help and support.
Yep.
that we need, and that translates. And it's so interesting that you're saying, because it translates, right? It's like a cry for help. There's something going on, please see me.
Exactly.
Yeah.
Yeah. So when I get back those results, it does make it a little challenging for me.
Yes, of course, of
But
course.
I hope by the end of the assessment that we get to some conclusion that could best like explain what's going on for them so that they could start getting the treatment that they need.
Mhm. Absolutely, absolutely. What is the overall benefit? Because I know that there's parents that are listening to um, our show tonight, and maybe, they've heard things like, oh, maybe a psychoeducational assessment would be beneficial for your child, but because of the history of overdiagnosing our kids, right, misdiagnosing our kids, um, there's parents that might be listening that are hesitant, like, I don't want to add another label to my child, or I don't want them to be misjudged. Like, what would be a benefit of getting this done?
So in the school, or if your child is still in school, there's a lot of benefits to getting an
Hmm.
assessment done.
Hmm.
If your child is struggling, this assessment could open up doors of support.
Hmm.
So your child could get extra time for exams, for example, or they might have a quiet space to do the exams. And when they get to the university level, you have to have a diagnosis in order to access these types of supports. In elementary and high school, they could still offer them without the diagnosis.
Hmm.
So you might be in a situation where your child does get these supports, and then when it's time for university, they no longer have them because they don't have an assessment done. So you need to
Hmm.
have the assessment, especially at the university level, to get access to these types of supports. And that's the benefit for having like something to explain why your child is struggling. And
Hmm.
even like I know a lot of parents are afraid of labels and you think that this assessment is going to give you a label, and essentially it does give you like a label, but even without the assessments, your child can still get a label. Your child
Mm.
the label of he's difficult or the child is rude, and all of those are labels too. But if we have the assessment to explain, okay, he's not being difficult, the reason why he is so rigid in his thinking or he gets so upset when routines are changed, it's because
Mhm.
he has autism, and it's not because
Mm.
he's rude.
Yeah,
So that helps to help people to be more empathetic, I would say.
absolutely, absolutely. And have you heard from, other Black parents that having like a Black psychologist in these situations has been helpful for them in this getting the support and getting access?
Yeah, I find that a lot of Black parents feel more comfortable, especially when it comes to like the educational setting, because they've heard a lot of negative stuff about their kid already, and the
Yes.
majority of the people in the educational system are not Black people, so they have their defenses of they don't want somebody who looks like the same educators who may be white
Mm.
assess their child too, because they might feel like there's a bias there. So if they get somebody who looks like them, they might feel a little bit more comfortable to say, okay, they don't necessarily have this negative view of my child. Maybe they'll be um, more empathetic towards my family because I've had
Mm.
all this negative things that I've heard about my child from the school system.
Absolutely. Right? Which again feeds into that representation, right? Like, there's a comfortability, especially when you're navigating, those various, and trust me, I have been there where, I've had to advocate for my children. And trust me, when I roar, I have a button. I always tell everybody in the Love Bay family, I have a little button right here. that when it flips, I'm not too right, too right. Okay, but but anytime it has to do with my kids, it goes off every once in a while, right? And because when it comes to our kids, yes, many times they are misjudged, right? Many times they aren't getting the supports that they need, and and it's tiring, having to be this advocate, but we do it because we know we need to. But then when it comes to, like, okay, you're hearing, oh, they're not sitting in circle time on the floor and the carpet, you know, you're like, okay, well, there's a lot of energy in that body. Maybe this body, operates differently. And then you hear, oh, maybe they have ADHD or ADD, and which if they have it, they have it. But you're right, like having this assessment can be a tool, but it can be scary because you've heard the stories, right? That, oh, they just said that my child had ADD or ADHD and we need to put him on meds. And a lot of parents even get scared away as soon as they hear meds because of, again, that, I guess, that history that has happened over the past few years, at least when I was growing up, you know?
Yeah. And I know medication is still something that's fearful to
Mm-hmm, mm-hmm,
look at. And you think that some parents might think if I do the assessment, then they're going to force me to do medication. But in
mm-hmm.
reality, you have consent all along the way, even consenting to
Exactly.
do the assessment. Like,
Mm-hmm.
school can't do the assessment without your consent.
Mm-hmm.
So, and then with the medication, your child doesn't get the medication without your consent.
Mm-hmm.
And that's something to always like make sure when you're making a decision as far as consent is to get all the information first before you say yes or no. Know about the benefits, know about the risk, and then you make your decision after that. Don't immediately say no because of fear. Say no because now you have all the information you need and you realize, okay, this is not the right time to do this. Maybe
Mm-hmm.
I'll get it again in the future. Or is there any alternatives
Yes.
to addressing the issue?
Absolutely. And I do think that that is one of the differences, right? Like, I don't know, at least for myself, I know that, but when it comes to like my first session, I tell people it's the boring session. So come, expect with popcorn, expect that it's gonna be a little bit blunt because I go through my informed, because I want my clients to be informed about the policies, informed about their rights as clients. And I think that even we understand what it feels like to not get that information, to not be informed properly. And these are the different nuances that I think that happens in representation because we take these types of things into consideration, that we know what it's like to not get this information. We know what it's like to um, be misjudged. Like, I was thinking the other day, even just to go to the doctor when I was growing up, right? My mom's like, Felicia, you all right? I'm like, mommy, I'm the youngest, so I'm like the bratty one, okay? And my mom would make me dress up in my church clothes, and she would dress up in her church clothes just to go to the emergency room.
Mm. Fear of
And I
judgment.
fear of judgment, right? And this shows up. This shows up even when it comes to any type of medical or health appointment, right? And
Mm.
a lot of people, because I hear it in the therapy world all the time. Oh, why does someone need to see someone who's of the same culture? Why? Like, it doesn't matter. I'm qualified to see them. And yes, very much so. Like, you have the education, but there is there is a difference. There is a nuance as well that does play into it sometimes. Um, Especially because, again, people are masking up when they're at work, right? where they can't really show their true selves because they're either overlooked or there's bias, right? Whether you want to call it conscious or unconscious bias, whichever, but it's bias is bias. Okay.
Yeah.
And then now you're expected to, now you need a place to unwind in the sense where you're there to really just talk about the thing, talk about what's been bothering you, talk about, you know, even like you mentioned earlier, like those various difficulties of, being overlooked at work or the microaggressions and stuff like that. And then you have to, on top of that, you have to explain why it's a microaggression.
Yeah, exactly. Yep.
Like, oh, why was that so bothersome? What do you mean why it was so there's I don't know. Fiona, maybe it's just me, but there's times when my clients just say a thing and
And you
I just look at them and then they look at me and then I look and we know exactly what we're saying, right? And sometimes I have to say, okay, for my note taking device, what we're trying to say, and then I have to articulate it because we've already said everything that we need to say because we can. It's just like it's an embodiment, which also in our cultures, the way that we express ourselves is different.
yeah.
It's a talk about the thing, Fiona. Talk about the thing. Mm.
Well, this to see how you're using your dialects, like
Mm.
you could do that with somebody who's not a Caribbean background, right?
Yeah. Hmm.
That means you have to like hide that part of yourself and essentially not be fully relaxed because you're not able to bust out in your dialect.
Absolutely. Even that makes a difference because that in itself is healing. As soon as I bust out in my own dialect, I'm like, yay! I feel free, And we can laugh, we can cry. We can talk about particular things, even in our families, right? Where it's just like, yeah, and my parents did this, that, and that. And it's not taken out of context or it's called out for what it is or what it was that are
Mhm.
and being able to make those deeper connections without having to go like the extra mile to explain exactly what those things are. And I
Yeah.
know, at least for myself, with the clients that I see, they have said that that has made a huge difference for them, right? And that they feel like they've made a lot of progress in therapy, right? Which I'm sure that you've also seen as well.
Yeah, for sure. A lot of people appreciate being with a person of the same color as themselves. Yeah.
Absolutely. And before I get crucified on any stone, I know not everybody will get it. I get that. I understand that not every therapist is the same, and maybe some people, even though they are Black, they may not get it either, in a particular way, or maybe they may miss certain things. I
Yeah.
get it. I get that. I'm not trying to blanket anything at all, but I would say that overall, it does make a difference. You just have to find the right fit. And if you see one person and they are not hearing you, they're not getting you, they're not seeing you, even if they look like you, even if they have the same culture, then child, go see somebody else.
Yeah.
But there needs to be more of a. I get so excited when I see like diversity in our field. That's why when I saw your event, I said, "What? I
Yeah.
need to be there. I want to be in the room."
Yeah, and that's the thing, right? Like we're talking about representation, but at the same time there's not a lot of us. Yeah, so that finding somebody who looks like you will be a challenge. And especially if you're looking for someone to do like a psychological assessment,
Of
that's
course.
even more of a challenge.
I think I have you talk about it today because I want people to know that there's a Fiona Andrews from Embrace what? Embrace
So,
Well?
Embrace
Embrace
Well.
Well Psychotherapy Services in Ontario that does. Are you accepting clients right now?
I am accepting assessment clients, yes.
Oh, so you
Therapy
see,
clients, not right now.
okay, that's okay. But you see, it's it's like this, right? Because people don't know, right? When you do a Google search, it's hard to find. And then this is what we talk about when we talk about access, right?
Yep.
If- and especially because there are so few of us, more of us are interconnected because we try to seek out other therapists that we if we're not a, like if I'm not a good fit and somebody else that I know is a better fit, I will be sending them that person's way because I know I have a pool of people that I know, right? So I better believe if I know someone needs a psychoeducational assessment and they're like, I need a black therapist, I'll be sending them Fiano's way, right? So yeah, so talk about the fact that there aren't enough of us. What is this? I know that you had some stat. Do you remember the stat? I never asked you ahead of time. So if you don't know it off the top, that's okay
Well,
too.
it's not that hard to forget. There's less than 1% of Black psychologists across Canada. And
People, did you hear that? There is less than 1% of Black psychologists across Canada.
and that 1% means out of all psychologists, it's like only 1% of us. And majority of them are in Ontario. So if you're in another province, it's even harder to find the Black psychologist. In Ontario right now, we don't know exact numbers. These are all estimates. But there's probably about 70 or so in Ontario. And in other provinces, it'd probably be like less than 10 for the province.
Sure.
Yeah.
Those stats say it all. Why is it so important for us to know these stats? Come on, spell it out for us. Spell it out.
Well, it highlights like the barriers to get this degree. There's so many like blocks and roadblocks along the way that a
Mm-hmm.
lot of people just say, you know what, forget it. I'm not going to be a psychologist. And some of the pathways to be a therapist, some other pathways to become a therapist are a lot easier, like psychotherapy,
Mm-hmm.
for example.
Yes, absolutely.
You'll find a lot more Black people in those spaces versus
Mm-hmm.
psychologists because there's so many hoops that you have to jump through to become a psychologist.
Girl, I saw those hoops. I said, whoop, there it is. It takes it's very tedious, and of course there's systemic oppressions even in the educational system and the
Yeah,
barriers and stuff like that.
pricey too, and you might
Mm-hmm.
have to go to another country to get, like the states, for example, to get into
Mm-hmm.
schools because there's so much competition to get into the programs. They only maybe take on like 10 people or something for the program, and sometimes you have to like have like the research person or whatever for the department to take you on as one of their pupils. So if you don't have those connections or research experience or whatever, it makes it even harder to get into the programs. So you might have to like search to go to the States, but if you don't have money or if you have a family already, it's not easy to just pick up and go to the States. So those are all things that kind of stop people from becoming a psychologist.
Absolutely. And on average, how long does it take to become a psychologist?
So 4 years undergrad, 2 to 3 years masters, and like 4 years, sometimes maybe 3 to 5 years, depending on the PhD program. Um, but there's some provinces that allow for master level psychologists.
Mm-hmm.
So there are master level psychologists. So you could not have to do your PhD and still have the
Mm-hmm.
title of psychologist. So
Mm-hmm.
that's one. I guess, barrier that is taken care of as far as having to get your PhD. But in Ontario, it's still the PhD technically. But if you are registered in another province and you come into Ontario with your master's
Mhm.
level psychologist title, they honor it.
Okay.
Yeah, so
Okay.
I'm a master's level psychologist
Mhm.
in Ontario.
Absolutely.
Technically, they would want you to have your PhD if you are not registered in another province with the master's level.
Mm. And one of the questions I get a lot, so I think, and don't worry if you don't know all the, although I feel like you know all the answers anyhow. I didn't prepare today in a love base, so take it easy, take it easy. All right. So one of the biggest questions that I get often is, what's the difference between a psychiatrist, a psychologist, a psychotherapist, a counselor? Those there's the four, right?
Okay.
You can take anyone and
Try
whatever you
my
know.
best to answer all of them.
Okay.
Okay, so um, psychotherapists, psychologists, and psychiatrists, all three are authorized to offer psychotherapy. So
Ding ding ding
psychotherapy
ding.
psychotherapy is basically the talk therapy. Um,
Mhm,
so all three could do that, or authorized to do that. Not all do, like psychiatrists, not all psychiatrists do psychotherapy. Um, but all three, I believe, are able to do it. Now, the prescribing of medication,
mhm,
only psychiatrists are authorized to prescribe medication.
mhm.
Psychologists and psychotherapists and counselors are not able to do that.
Yes.
Assessments, only psychologists and psychiatrists are authorized
Mhm.
to do assessments. So
Absolutely.
therapists and counselors are not able to do that. Now,
That's
the
right.
difference between psychotherapists and counselors, I am not confident on the differentiation between those two, but I believe counselors are more of like they more work with people who have like general stress and things like that, not necessarily individuals who have like a um mental health condition. Am I right about
Mhm. Yeah, so counselors aren't regulated with at least in Ontario, they're not regulated with the College of the Registered Psychotherapists of Ontario. So
that?
psychotherapists are, or registered psychotherapists are. Other professions, also like social workers, can also practice psychotherapy. Nurses can practice psychotherapy under their college.
Mhm.
Um, but with regards to psychotherapists, we have to make sure that we are practicing utilizing evidence-based modalities in our work. That whereas with counselors, they don't have that regulation. So you know it could look different, right? So you do have like certified counselors that may come through like an
Yeah.
association or something like that. But a registered psychotherapist uses research backed, evidence based modalities to treat various mental health concerns. But we don't diagnose. I love to tell people, listen, I don't diagnose you. Now I could get you a referral or something to maybe if we need to look into something further, or
Yeah.
I'll recommend you go to your family doctor. But I can't diagnose. I can't make do an assessment. If it's out of my scope, it's out of my scope. But and then yes, so yeah, ding ding ding, girl, you get a gold sticker. There you go. Well done, right? So, lovely family, I hope that was informative for you if you were ever wondering about what the differences are, right? But again, I think you see the need for even more of us in the field, right? Because 1% is not enough, considering
No.
the diversity of our country. Like there needs to be more. And if there's only 1% of Black psychologists in Canada, right? How many people are being overlooked right? And how many people may not feel like their experiences are being understood in a particular way. And not to say that those outside of our culture may not get it, they may very well get it, right? But there is, again, a comfortability that can come with that recognition and reciprocity of understanding, sharing knowledge, sharing certain life experiences.
Yeah. And to add to the dilemma of 1% of Black psychologists,
Oh boy, here we go.
because there's so few of us, sometimes it's hard to access us because we might have like a caseload, it might be full or something like that.
Of
But
course.
I want to highlight that depending on what the situation is, that you
Mhm.
might have to get the help from someone who is not Black. Just because
Yeah.
if it's something that is immediate or something that is like life or death, you don't want to wait until you see a Black person to take care of you not. Go to whoever is available.
Yes, of course. No, I'm waiting, It's been 5 years, but
Yeah, I don't want people to to see a Black person just because, but then you are like struggling. Get
yes.
the help from whoever is available. And then once you're like stabilized, if you want to wait to see if a Black psychologist is available, then seek one at that point. But if it's something that's of a crisis or
Hmm.
something that's really like, sometimes there's cases where it's like a specialized situation where, for example, OCD, some
Hmm.
people are very like what's the word I'm looking for? Impaired. That's not the word I was looking for, but I'm gonna use the word impaired because that's the word that came to my mind.
Okay.
So they're severely impaired, and
Yeah.
they might require every day, like a daily intervention versus like a week
Mm.
or bi-weekly. So a lot of like private practice may not have availability to service somebody daily. So you might
Hmm.
have to seek more of a specialized service at a
Hmm.
hospital, for example,
Mm.
and the
Yeah.
hospital may not have a Black psychologist available. So now you're thinking, okay, but I really want a Black psychologist, but what you need is somebody to see you daily. So you're gonna should see somebody who could see you daily to
Hmm.
help you to manage that severe impairment. And then once it's like the impairment might be mild, then you could maybe wait to see a Black psychologist. But if you require that like intense support, you may have to expand your
Hmm.
options.
Absolutely. So once you're at a more stabilized place, you could explore more options and maybe, you can get a service that you you've been looking for but may not have received otherwise. And
Yeah, you could be more picky once you're more stabilized. But
it could be more picky. Yeah.
don't be picky when you're in the severe state.
Absolutely. Absolutely. So, when it comes to like um, finding a therapist, finding a psychologist, some people may be hesitant to even like explore those options because, you know, maybe they've been seeing a therapist for a long time and they're afraid of what we call, I guess, like the shopping around and stuff like that. Like, what would you say to those that are listening that may feel like they don't feel heard currently, they don't feel seen, and they're curious, or maybe they haven't even done therapy before, and they're like, should I should I see a therapist? Should I see a psychologist? Like, what would you say to them?
Well, if you are currently seeing a therapist and it's not working for you, you can technically break up with that therapist. We appreciate when you actually like let us know and not ghost us. That's helpful for for us on the other end to know, okay, you're ready to discontinue or you're ready to explore other options. Don't worry, we don't get offended. but it's
Yeah.
helpful for us to know so that we could like close off your files properly and not worry that something has happened to you. Um, but yeah, so if you're already seeing someone, that's what you could do. But then if you're doing looking for someone for the first time, um, you could have like a consultation with the person to see if they're a good fit for you.
Mm-hmm.
A lot of therapists offer free consultations, like 15, 20-minute consultations for you to introduce yourself and them introduce themselves to you, and you could ask questions and things like that. You could get like a sense of how they are. Some people
Absolutely.
have online presence, so you could get to see their personality and stuff beforehand. So that's I guess a positive. You could see, okay, I think I could gel with this person or whatever.
Yes.
Um, so that's um, various ways that you could approach that situation.
Absolutely. And you are listening to the Mental Health Hour on Love Bay Afrobeat Music and Talk Radio. Tonight we're asking an important question. Does representation in therapy really matter? We're exploring how culture, identity, and lived experience, trust, and belonging can shape the therapeutic relationship, and what it truly means to create mental health spaces where people feel seen, heard, and understood. And speaking of creating spaces for connection, opportunity, and community, I want to take a moment to share an exciting event happening this weekend. As a not for profit organization, Love Bay Radio is committed to giving back to the communities we serve. Throughout the year, Love Bay creates opportunities for education, connection, mentorship, empowerment, and meaningful community conversations. And this Saturday, July 11th, Love Bay Radio will be hosting the fourth annual Voices of the Millennials Youth Summit at Humber Valley United Church in Etobicoke. This powerful event brings together youth, students, professionals, entrepreneurs, educators, and community leaders for a day of networking, mentorship, meaningful conversation, and opportunities for growth. Attendees will have the opportunity to hear from inspiring speakers, build valuable connections, explore career pathways, and engage in conversations designed to help shape their futures. The Voices of the Millennials Youth Summit reflects something we talk about often here on the Mental Health Hour: the importance of community, the importance of opportunity, and the importance of creating spaces where the next generation can feel supported, encouraged, and be empowered to imagine what is possible for their lives. Because when we invest in our youth, we invest in our communities, and ultimately, we invest in our future. For more information about the fourth annual Voices of the Millennials Youth Summit, connect with Love Bay Radio at luvbayradio.live. That's lovebayradio.live. Or call us at 437-778-3299. And now we're going to jump right back into tonight's conversation. Fiona, where are you at, girl? Yeah. Amazing, amazing. And thank you so much for sharing about, consultations. For those who have never done a consultation before, right? And, they're listening to our conversation tonight and they're like, yeah, I think that is something that I desire, having maybe somebody that may be able to resonate a little bit with my lived experience. What are some questions maybe that they can bring up in a consultation? What should they expect from a consultation? Because I think you hear a consultation, you think, oh, that's scary. Like, consult on what? Like, what does that look like?
Consultation is really just for you to get to know what type of therapist or type of therapy the therapist does, because there's different
Hmm.
modalities. So they'll probably talk about the modality that they're most familiar with and how they can support whatever challenges that you might briefly explain. You don't have to go in talking about your whole life story. You might just briefly say, oh, I'm having relationship issues, or I'm looking for help to manage stress or help to manage anxiety. And then they could discuss how they would help you to support those things.
Mm-hmm.
And then you also would look at like the fee structure and how much how much the service would cost, and then whether or not they take direct billing, or if you have extended health benefits to
Mm-hmm.
cover the sessions and things like that. So those are things that you could confirm on the call, as well as availability and whether or not they do in person or virtual. um, and you might ask questions like what their experience might be, um, things like that. You could ask them.
Absolutely. So we don't bite, we promise. Okay, I nibble a little bit, but that's about it. Just a nibble. We don't bite, and again, it is a space to just, I call it a meet and greet. I tell people this is just a meet and greet. So hopefully that takes the pressure off, right? It is really just to get a feel of if I'm a good fit for you. And no hard feelings if you say, no, that girl, she's not the therapist for me. That's okay. I actually am happy when a client's like, actually, I found another better fit. I am happy because I think that that is probably one of the most important indicators if you have a good therapeutic fit with
Yeah.
your therapist.
Hmm.
Right? It makes a difference,
It does. For sure.
right? Absolutely, absolutely. And maybe there's some people that are listening tonight that they're afraid of what it means if they go to therapy. And I know that we were talking a little bit about stigma earlier, right? But what may be some indicators that maybe, I mean, I am a strong believer that everybody needs a therapist, but that's just my take, right? But what may be some indicators that, okay, you should really seek out support, whether it's from a psychiatrist, a psychologist, or a therapist?
So generally, we would experience the feelings of sadness and anxiety and anger. And having those feelings are not necessarily a bad thing to have. There's
Mm-hmm.
times when it's appropriate to feel sad and it's appropriate to feel anxious. And even with anxiety, there's positives to that. And even there's positives to anger too, if you want to talk about that briefly. But I could say for
Yes.
anxiety, the positive for anxiety is like, for example, if you are doing a test or you have an upcoming project for school or whatever, having that little bit of anxiety is going to push you to start studying.
Mm-hmm. Mm-hmm.
With anger, having that anger is going to push you to protest. And a lot of the things that we may have now as freedom is because of anger. People were angry, they were oppressed.
Yes,
And
100%.
now we have these different civil rights because of anger, right? So
Mm-hmm.
there's positives to these emotions. When it becomes an issue now is when you see anxiety inhibiting you, or you are supposed to do this test but you don't show up because you're so nervous, and now you have this failing grade all because
Mm-hmm.
you're so anxious about this test, or this
Mm-hmm.
anger that you have, instead of channeling it for good, you are using it to hurt people.
Mm-hmm.
You're hurting people's physically, or you're hurting people emotionally, and you're not able to control it.
Mm-hmm.
When you're sad, like if we're all sad when we lose things, whether it be like a life that we lost or something important to us.
Mm-hmm.
But when it becomes an issue now is when you haven't been going to work for how many weeks now? Like you are allotted a time to grieve, but now as you're adjusting back to work and gradually going back to work, is it still being difficult for you? Are you now like losing weight? Are you
Mm-hmm.
now like not sleeping at night? So those are the things that you start looking at, like how is it impacting your day to day? How is it
Mm-hmm.
impacting your relationship? How is it impacting your work? How is it impacting your school? If it's so impairing, then that's when you need to seek support.
100%. Did you write all of those things down, Love Bay? Right? Those are important things. I love that you highlighted that it impacts your daily functioning, right? And that I love that you explained even some of the differences of what that could look like, right? Especially your basic needs. If you find that you're not sleeping, eating, and I love that you talked about the relationships. It's impacting your relationships around you. Yes. Call us, beep us if you want to reach us, right? Okay, Kim Possible, don't sue me, I promise. Okay. Sophia, if you could leave one last gem with the Love Bay family tonight, what would that be?
This is where you're putting me on the spot.
That's right, girl. That's right. That's right.
One last gem. Well, first of all, I want to say when it comes to like mental health in our
Mhm.
community to erase the stigma behind it.
Yes.
It's mental health is like it's a spectrum. We all have mental health, whether it be health,
Yes.
whether it be we're doing well with our mental health or we're not doing so well with our mental health. So we need to like know where we are on the spectrum and where we're supposed to get help and when we are okay and are managing. So getting the help doesn't mean now that you are weak, and it doesn't mean that God is not in control.
Mm-hmm.
Another when it comes to the Christian community, um,
Mm-hmm.
if we're not praying about it, then something is wrong, right? Like
Mm-hmm.
we rely on prayer, which is good. I believe in prayer. I'm Christian, so I'm not
Mm-hmm.
against that. I believe in prayer, but God also has ordained therapists to support
Mm-hmm.
the process of what He can do, and He's gonna use these individuals to help support you in your mental health journey. So
Mm-hmm.
don't be afraid to get support, and it's not anything to feel ashamed about. So I guess that will be the gem that I'll leave for your listeners tonight.
You heard it yourself, Love Bay, okay? It is a tool, okay? And there is no shame in seeking out support. Amazing. So, as we come to the end of tonight's conversation, I keep coming back to one powerful truth: feeling seen matters, feeling heard matters, feeling understood matters. And when someone enters therapy, they should not have to leave important parts of who they are outside the door in order to receive care. Tonight, Fiona reminded us that representation in therapy is about more than simply seeing someone who looks like you. It's about trust, safety, culture, identity, belonging, and the ability to bring your experiences into a therapeutic space and know that they will be met with curiosity, respect, and care. Culturally responsive mental health care requires us to recognize that none of us exist outside of context. Our families shape us, our communities shape us, our cultures shape us. Our identities and lived experiences shape the way we understand ourselves, our relationships, our struggles, and even what it means to ask for help. And when those realities are ignored, misunderstood, or minimized, it can create another barrier between people and the support they need. But tonight's conversation also reminds us that culturally responsive care is not about assuming that shared identities automatically create understanding. It is about being willing to listen, to remain curious, to recognize what we do not know, and to create spaces where people do not feel that they have to explain away, minimize, or hide parts of themselves in order to be supported. I want to thank Fiona Andrews for joining me tonight and for sharing her expertise, her insight, and her perspective with us. thank you for helping us move this conversation beyond surface level discussions about diversity and towards a deeper understanding of what representation, access, trust, and culturally responsive mental health care can truly mean. And to everyone listening tonight, whether you are looking for a therapist, you're already working with one, you're considering reaching out for support, or you are a mental health professional yourself, I hope that tonight's conversation leaves you with something to reflect on. Because every person deserves access to mental health care where they feel seen, and again, where they feel heard and where they can feel respected, and where the fullness of who they are is welcomed into the room. Before we close, I want to invite you back next week for another powerful conversation on the Mental Health Hour. It's Baba Shop Tuesday, which means our brothers Josh, Kunle, Matt, Gavin, Andrew and Andrew, yes, there are two Andrews, are coming back for another honest and meaningful conversation centered on men's mental health and well being. Next week's episode is titled Love After Pain, Divorce, Heartbreak, and Starting Over. What happens after the relationship ends? How do men navigate divorce, child custody, co parenting conflicts, betrayal, heartbreak, and the complicated process of starting over? And what does it mean to open yourself up to love again after you've been hurt? Next week, the barbershop panel is getting real about love after loss. The lessons they've learned, the things they might do differently, and what healing and rebuilding can look like after a relationship ends. Because sometimes the end of a relationship isn't just the loss of another person, it can mean grieving the life you thought you would have, rebuilding your identity, learning how to trust again, and figuring out who you are on the other side of heartbreak. Join us next Tuesday at 7 p.m. Eastern Standard Time. If you're in another time zone, you can convert it, okay, for Love After Pain. Diverse heartbreak and starting over right here on the Mental Health Hour on Love Bay Afrobeat Music and Talk Radio. You don't want to miss this one. So, thank you for spending this evening with us on the Mental Health Hour. I'm your host, Felicia Fishoff, registered psychotherapist and founder of Rooted in Resilience Psychotherapy and Wellness. Take care of yourselves, take care of each other, and remember, you deserve spaces where you do not have to make yourself smaller to be understood. Good night, everyone. Peace